Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Chancroid is a bacterial infection. It primarily affects the genitals and causes painful sores. These sores can be quite distressing and uncomfortable for those who are infected. These sores can be open and bleed easily, making them susceptible to further infection and complications if not properly treated. Chancroid is spread through sexual contact, which means it can be transmitted from one person to another during intimate activities. Imagine a small cut or sore, but on your genitals. This can be both painful and alarming. That's what a chancroid sore can look like. It's crucial to recognize these symptoms early for effective treatment. It's important to remember that not all sores are chancroid. Other conditions can cause similar symptoms, so proper diagnosis is essential. Chancroid is more common in certain parts of the world, particularly in areas with limited healthcare resources. These areas often have limited access to healthcare, making it harder to get timely and effective treatment. If you think you might have chancroid, don't panic. Early diagnosis and treatment can prevent complications. It's treatable with the right medications. Consult a healthcare professional to get the appropriate care and ensure a full recovery. A specific type of bacteria causes chancroid. It's called Haemophilus ducreyi. This bacteria thrives in warm, moist environments. When this bacteria enters the body, it causes an infection. This usually happens through tiny cuts or breaks in the skin. You can get chancroid through sexual contact. This includes vaginal, anal, and oral sex. It's important to remember that having chancroid once doesn't make you immune. You can get it again. Chancroid has some telltale signs that are important to recognize early. The most common one is painful sores on the genitals, which can be quite distressing. In women, these sores can appear on the labia, clitoris, or vaginal opening, making daily activities uncomfortable. Men usually get sores on the penis, which can be very painful and alarming. But sores can also appear around the anus in both men and women, adding to the discomfort. These sores often start as small red bumps that might be mistaken for something minor. They quickly turn into open sores, which can become more severe if not treated promptly. The sores can be extremely painful, especially during urination or sex, affecting quality of life. Other symptoms include swollen lymph nodes in the groin, which can indicate the body's response to infection. These swollen glands can be painful and tender to the touch, making movement and sitting uncomfortable. Early diagnosis and treatment are crucial to manage symptoms and prevent complications. If you notice any of these symptoms, consult a healthcare provider immediately for proper care. Section 4. Getting diagnosed. Tests and examinations for chancroid. Diagnosing chancroid involves a few steps, each crucial for an accurate diagnosis. First, your doctor will ask about your sexual history, including any recent partners and symptoms. This helps them understand your risk factors and potential exposure to the infection. Next, they'll examine the sores on your skin, looking closely at their size, shape, and location. They'll look for the characteristic appearance of chancroid sores, which are typically painful and have a soft base. Your doctor may take a sample of fluid from the sore using a swab. This sample is sent to a lab to check for the presence of the bacteria Haemophilus ducreyi, which causes chancroid. There's no single test to diagnose chancroid, making the process more complex. Your doctor will use a combination of your medical history, physical exam, and lab tests to make a diagnosis. This comprehensive approach ensures that other similar conditions are ruled out, providing a more accurate diagnosis. Section 5. Treatment options. Battling chancroid and finding relief. The good news is chancroid is treatable. Antibiotics are the primary treatment for this bacterial infection. Your doctor will prescribe a specific type of antibiotic based on your individual case. It's crucial to take the full course of antibiotics as prescribed. Even if your symptoms improve, don't stop taking the medication early. This can lead to antibiotic resistance. Along with antibiotics, your doctor may recommend pain relievers. These can help manage the pain and discomfort associated with chancroid sores. Section 6. Prevention is key. Staying safe and healthy. Preventing chancroid involves practicing safe sex. Using condoms consistently and correctly is crucial. Condoms act as a barrier, preventing the transmission of the bacteria. However, it's important to note that condoms don't offer 100% protection. Limiting your number of sexual partners can also reduce your risk. Open and honest communication with your partner about sexual health is essential. Regular testing for sexually transmitted infections or STIs is vital. especially if you're sexually active. Section 7. A final word. Your health is important. Remember, your health is your responsibility. If you notice any unusual sores or symptoms, don't hesitate to seek medical attention. Early diagnosis and treatment are key to preventing complications. Chancroid is treatable, and with the right care, you can make a full recovery. Never self-diagnose or self-treat. Your doctor is your best resource for accurate information and effective treatment options. UMCC, your ultimate medical consultant connector.